Mutations in MDS have become increasingly relevant for diagnosis to follow up post-hematopoietic stem cell transplantation. Of course, is that the only single curative therapy and its precise indications is essential for a fundamental aspect is to select the best donor, cell source, and type of conditioning, which forces us to define post-hematopoietic stem cell transplantation goals. We decided to start the correlation of stratification with our IPSS with overall survival, considering that we don't have molecular analysis as a tool in many places in Latin America. We analyzed data from 341 patients with MDS from the transplant registry of 32 centers in Latin America, from 1989 to 2022. Statistics were performed using IPSS V23.1, considering a significant P less than 0.05. Mean age was 46 years. That's an important point because we have younger patients in our register. Most patients were less or equals to 50 years. About 21% were between 50 and 61 years, and only 30% were with more than 60 years. There was a predominance of males. And regarding to the prognostic score system, IPSS-R, patients were classified as very low and low risk in about 13%, about 25% with intermediate risks, and high risk and very high risk, it's about 25%. A total of 141 patients, 41% patients have no data about our IPSS-R stratification. It's interesting because this patient that goes to transplant without stratification, they had a very good response to transplant. And we, of course, you have to question, to make a question about this. That really these patients are indicated to go to transplant, and it's reinforced the importance of stratification of these patients to before transplant to have a good indication. Myeloablative conditional variable was performed in 250 patients, about 73%. The predominant donor type was related, 69%, and non-related about 22%, and identical, it's about 80%. But in some cases that we did prior treatment, it doesn't have impact in the results. It's important. In 2020, we published our data from this, that the pre-treatment or not treatment that influences the results of hematopoietic stem cell transplantation. Another very interesting point is about the GVAD. We don't have the most important complication was infection. The most important cause of death until 100 days of transplant was infection. And after 100 days, the primary disease was the most important cause of death. And the frequency of death was about 40%. And for patients without our IPSS stratification, the 2 years overall survival, as I said, was 65%. That we have to reinforce the discussion. The 5 years overall survival was 50%, and patients with high and very high risk patients had a lower 2 years overall survival when compared to intermediate and low and very low risks. In this scenario, with the possibility of the IPSS-M stratification, with the importance of molecular stratification, we know that a lot of studies of real life, and they find that it can change the stratification, and patients in some studies they have 46% of changing of this stratification. But for us in Latin America, it's very difficult to use the molecular aspects. And we should, of course, try to improve this and try to implement in our practice. But until this moment, it's not accessible to all countries. Then we should try to use, at this moment, the IPSS-R as a reference and try to improve and to use another parameters to stratification. The data presented show that IPSS-R stratification influenced the outcomes of hematopoietic cell transplantation in patients with MDS, particularly the risk of death. The use of IPSS-R scores associated with other features as age and comorbidities can improve the management of MDS patients, especially where the molecular analysis is not available.